Hello there, Pattaya. It's Dr. Ian at the Bangkok Hospital, Pattaya. Today my special guest is Dr. Suttaporn. Now, Dr. Suttaporn is a specialist in cardiac rehabilitation. Welcome to the program, Doctor.
Thanks. Morning, Dr. Ian.
Okay, tell us a little bit about cardiac rehabilitation and how that is different from the ordinary rehabilitation that we know about.
The cardiac rehabilitation is the service are comprehensive long-term programs consists of the medical evaluation for risk of exercise and activities. Is also involve the risk factor modification, for example, the weight management, stress management, smoking cessation, and also cover any risk factor for the having heart disease.
Right. So ordinary rehabilitation is more on the physical side, whereas your cardiac rehabilitation is specifically tailored for the heart. Is that correct?
Here is not only cover that's the individualized program tailored to individual patient, not only for the physical, but also cover the psychologically and also the social point of view, include the vocational status of the patient. We help the patient to maximize their function, so that they can resume their normal activities in each aspect with full confidence.
So, I mean, this is much more than simple physiotherapy.
It's broader scale than only physical therapy program. It's also include, as I mentioned, the risk factor modification, also the management in each problem that can risk for having another attack in the future.
Now, it used to be that patients who had a heart attack, myocardial infarct, had to spend 6 weeks in bed doing nothing. That's not the case these days, is it?
Sure. Nowadays, that's back to about 60 years, approximately 60 years back. That's like you mentioned. But since then, they keep, move patient as soon as possible. They began with the sitting, they move patient to share sitting by two doctors about 60 years back. They call it chair therapy that time. And then the evolution, nowadays we move patient as well to chair sitting, progress standing, marching, and then walking. Beyond that, they can also do the treadmill walking, bicycling.
In what period of time? Used to be 6 weeks before you could sit in a chair. How long now?
Right now, even the patients after the bypass surgery, on the first day, for some of our patients, able to sit down, at least bedside sitting, and then transfer to the chair. Maybe just only after the surgery, 24 to 48 hours, they're able to do so.
Right. So that really is a great step forward, and I can see why we then have to get specialists in cardiac rehabilitation, such as yourself. As I said, it used to be that you sat in the bed and it was 6 weeks before you were even allowed to sit in the chair. I think we probably killed more people with deep vein thrombosis by having them sitting doing nothing than anything else. And it's good to see that there is this breakthrough to the kind of rehabilitation that you are doing today yourself. Dr. Suttaporn, thank you very much indeed. And Pattaya,
you're welcome.
You are in good hands, not mine, but Dr. Suttaporn. If you have suffered some sort of cardiac problem. Again, thank you.
Welcome.